Good morning, everyone, and welcome to the July meeting of the Program Advisory Committee. My name is Mara Madrigal Weiss, and I have the honor of serving as the co-chair of this committee. I want to begin by thanking each of you for your continued time, commitment, and willingness to serve in this important advisory capacity, which will help us shape thoughtful and forward-looking external strategies to strengthen research, evaluation, and programmatic efforts. Sorry, when having technical difficulties over here. Okay, today we are going to hear updates on three of the Commission's key grant programs. First, we will hear an update on the Innovation Partnership Fund, followed by an update on the Mental Health Wellness Act funding, and conclude with an update on the Behavioral Health Student Services Act ongoing funding. The purpose of the agenda items today is informational and meant to provide the committee and members of the public with an overview of the planning process for upcoming grant procurements. Now we will take roll and establish a quorum. Please note that under Bagley-Keene Open Meeting Acts Committee, members who are participating remotely must keep their camera on at all times and will be asked during roll call to disclose if they have any other adults ages 18 or over in the room with them during the meeting and the nature of their relationship with these individuals. So at this time, Sandra, if you could please take roll.
Great, thank you. I ask all commissioners joining us online to please unmute your lines for the roll call. Commissioner Bear.
Here.
Thank you. And identify if you have anyone over the age of 18 in the room with you.
No, I do not.
Thank you. Commissioner Burnick.
Here, and somehow my video isn't working, but I'll check with our IT people.
Anyone over the age of 18 in the room with you? Thank you.
No.
Commissioner Cross.
I'm here. I'm alone.
Thank you. Commissioner Fernandez. Marking absent. Commissioner Designee Swartz.
I'm present and I'm in person.
Thank you. Commissioner Tsai. Marking absent. Committee Vice Chair Madrigal Weiss.
Present and no one of 18 years or older in the room with me.
Thank you. We have quorum.
Thank you, Sandra. Let's move on to agenda item number 2. Before we begin, I want to remind everyone that we will be abiding by the Bagley-Keene Open Meetings Act laws for these meetings. As part of our commitment to deeper public involvement in open governance, all advisory committee meetings include an enhanced public comment segment designed to promote genuine dialogue between the committee and the community. We look forward to learning from your experiences and collaborating toward better outcomes for our community. As part of our ongoing commitment to transparency and collaboration, we want to ensure that information flows seamlessly across CBH committees. To support this effort, we will take a moment to review key updates from the other 4 committees. By sharing these updates, our goal is to keep everyone aligned, streamline communication, and foster a more connected approach to our work. Cody, please bring up the committee highlights slide. Since the PAC last met in April, there has only been one Legislative and External Affairs Committee meeting, which took place on June 18th. As the slide indicates, during that meeting, the LEX Committee voted to approve both veterans and the LGBTQIA+ advocacy contract procurement, outline plans not to exceed $2,010,000 each. It is now time for agenda item 3, general public comment. This time is reserved for comments on items that are not on the agenda. Please note that for general public comment, which is the portion we are now in, individuals may speak on topics not listed on the agenda. However, commissioners cannot engage in dialogue as topics would not have been agendized 10 days prior to this meeting and thus would violate Bagley-Keene requirements. That said, CBH staff will follow up on topics as needed or as appropriate. Marcus, please lead us into public comment.
Thanks, Chair. If you'd like to make live meeting transcription or closed captioning, please activate the closed captioning feature located in the control bar at the top or bottom over your screen. If there are any members of the public using transcription technology, please notify the chair so that we may be mindful. You may request to make public comment by submitting a card, clicking the raise hand icon on your computer or the app, or if calling in by phone, press *9. Members of the public can also email us public comments to be shared at a future meeting at publiccomment@bhsoac.ca.gov. And Chair, I am seeing no public comment in the room nor online.
Thank you. Then we will move on to agenda item 4. Agenda item 4 is the review of meeting minutes from the Program Advisory Committee meeting on April 16th. At this time, I would like to invite committee members to offer comments or ask questions. I don't see any on my screen. I can't see in the room. Are we good to move forward?
We're good to move forward.
All right. Then we will open up to any public comments regarding this item.
There are no comments in the room or online.
Okay, then I will ask for a motion to approve the meeting minutes. I need a motion and a second.
I'll move.
I'll second.
So can I get a last name? Who moved? Who seconded?
Cross for a second.
And who moved?
Fourth.
Swartz, thank you. We have a motion on the floor and a second to approve the April 16th, 2026 PAC meetings. Commissioners, please unmute your lines to facilitate this process. Commissioner Baer,
Yes.
Commissioner Burnick,
Yes.
Commissioner Cross,
Yes.
Commissioner Fernandez, marking absent. Commission Designee Swartz,
Yes.
Commissioner Sy, marking absent. Commissioner Madrigal Weiss,
Yes,
motion passes.
thank you, Sandra. Let's move on to agenda item number 5. For agenda item 5, we will be hearing a CBH procurement planning update on the Innovation Partnership Fund. For this item and for the remaining agenda items, staff will provide an overview of procurement planning activities, proposed timelines, and upcoming milestones. At the end of the presentation and discussion, we will move to public comment. This time I would like to welcome Melissa. Please come forward.
Thank you, Chair Madrigal-Weiss. And if I could get this slide up for the IPF, or yes. Okay, so I'm going to start with kind of a broad description of our procurement process, planning process for 3 of our upcoming procurements, including round 2 of the Innovation Partnership Fund, the next round of Mental Health Wellness Act funds, and then our ongoing Behavioral Health Student Services Act funds. So we really want to have a strategy that allows us to hear directly from key informants, from our county partners, from our state agency partners, and other key stakeholders to really understand what's happening at the local and county and state level, particularly as we're in this transition from MHSA to BHSA. So some of the planning activities that I'm going to discuss in the next couple of slides really cut across all 3 of these procurements, and then I'll move into some of the specific strategies and calendars and planning activities for each of the procurements that we have coming up. Okay, so our process to develop RFA and RFP outlines really involves a great deal of information gathering. And we do that through a number of methods and strategies. I'm going to talk a little bit in the next couple of slides about our strategy for conducting site visits. So this is really to go on site, on the ground, visit counties and contract providers within those counties to really understand service delivery, access issues, best practices that are bubbling up, and opportunities that are arising within those county sites. And again, that information and those site visits will really inform our procurements across the board. We are also conducting key informant interviews with state agency partners, with subject matter experts, and our technical assistance partners who are currently supporting existing grant portfolios. We also have a public process that includes meetings like the one we're having now, as well as our commission meetings. We have also done in the past listening sessions to really try to hone in on either a particular procurement or to hear from particular subject matter experts or those with or those with lived experience. This year, we are also planning to field a survey that will be disseminated to county behavioral health directors and their teams. So we really want to try to understand how counties are doing in the transition from MHSA to BHSA, and really try to lift up opportunities, gaps in the system, or areas where it would be valuable for the commission to lean in to support counties' transition to BHSA. We've also been doing analysis of our grant applications to look for themes, to try to understand clusters of need, or whether we can discern any particular clusters of need by region or by rural, urban. So just to try to use this kind of wealth of information as a data source. And then for our BHSSA upcoming procurement, we're going to field a grantee survey. So this will go out to all of our current BHSSA grantees. Again, all but one county has a BHSSA grant, and so this will be disseminated widely across those grantees to really hone in on the needs of students, particularly priority youth as defined in the BHSA. So just to spend a little bit of time on our site visits. So we are in the process of working with 3 counties to conduct some site visits in primarily in August. I think we're going to try to complete them during the month of August. And we chose these counties and these regions because we know that there are, for rural areas like in Imperial and in Humboldt County and in areas of Fresno, we know that there are particular needs for those populations. We also know that the needs up in the Superior region, in which Humboldt County is located, have very different needs than, say, the Sacramento area or LA. We identified Fresno as being representative of needs and opportunities for the Central Valley, and then Imperial County for representing a geographic area, obviously, in Southern California, but also as a border county, really trying to understand needs and opportunities there. These site visits, again, we want to talk with county behavioral health directors and their teams about opportunities that IPF potentially could support or should be orienting towards. We also want to better understand issues around the crisis continuum, and so some of our site visits are really going to focus on things like mobile crisis or field-based services that the county currently has in place to support the crisis work, and then also bringing in site visits to school wellness centers or other supports that our BHSSA portfolio funds. And again, kind of having those conversations shape our understanding of needs of those priority population, those students who fall under the priority population definitions. So we're really excited to be in conversation with these counties and look forward to bringing back to the PAC our findings from these site visits. Okay, so this grant procurement timeline is going to kind of be threaded throughout each of the presentations today, but we want to give our committee members a sense of what to expect and when. So for August, we are doing a lot of our discovery, a lot of our information gathering. Like I mentioned, a lot of we're planning on completing our county site visits during the month of August. We're hoping to get a lot of our key informant interviews finished, and we're hoping to send out our county survey during this month. So lots of activity, lots of analysis, information gathering, et cetera. Then in September, we are going to start drafting our outlines and kind of start landing on options for our Mental Health Wellness Act, BHSSA outlines or the RFP, RFAs. For PAC for September, we will come back with an IPF RFA outline. And I'm going to go into more detail about that in my next few slides. So that's what to expect for August, September. Then in October, after doing some internal and external review of our Mental Health Wellness Act and BHSSA RFA or RFPs, we will bring... Sorry, let me back up. October will be fleshing out Mental Health Wellness Act and BHSSA outlines, but we won't yet be ready to bring it to the commission. Instead, we're going to focus on bringing the IPF RFA outline to the full commission in October. Then in November, we will be ready to bring to the PAC the RFA and RFP outlines for Mental Health Wellness Act and BHSSA. We typically don't hold committee or commission meetings in December, so we will then come back in the new year in January and present our outlines for Mental Health Wellness Act and BHSSA, depending on the vote of the PAC. We'll be presenting that to the full commission in January. So that's kind of the cadence for PAC meetings and commission meetings and when to expect the outlines for each of our procurements.
Mara, I just have a quick question, if I can. Let's will we be getting sort of when you say outlines, I'm interested in sort of what you're seeing in the site visits. When you say outlines, will we be getting updates on sort of just your notes on what you're seeing with the counties and providers?
Yeah, that's a great question. Yes, our intention is when we present our outlines to also share kind of, summaries of the analysis that we did in our site visits, in our key informant interviews, et cetera. So that information will all be summarized and synthesized and, be reflected in the outlines. But, we'll also be, hoping to generate discussion from committee and commission meetings, and can share out the information then.
Yeah, I've just been, as the last year and a half, just going, trying to meet with providers, counties, and people we serve, and so forth. And it is obviously foundation of what we do.
Mm-hmm. Absolutely. Absolutely. Okay, I'm just one quick thing to note before I move on to the next slide is that this calendar starting the month of July and kind of extending through January 2027 allows us to really target a February 2027 RFA/RFP release so that we can do an intent to award for all three of these grant programs by May. So this is like our backwards mapping of targeting a May intent to award. Okay, so now that I've kind of given you the big picture overview of how our planning and kind of information gathering impacts all three of our procurements, I'm now going to just take a few minutes to go over Innovation Partnership Fund specifically. So just quick reminder that the Innovation Partnership Fund is established in statute and policy. The funding, which in that statute, it was established that the commission would receive $20 million per year for 5 years, subject to budget approval. As everyone is aware, we were able to retain year one's $20 million and are super excited that we're able to award the full $20 million and launch our first round of grantees. And we're now in the process of planning for year two, which is we're planning for $20 million to be allocated in year two as well. So I'm going to go into a little more detail in the next slide, but just by way of reminder, last October, the Commission approved our framework for IPF, and out of that framework, we developed and the Commission approved our RFA/RFP outline. That was in January of this year. The status is that we've now announced our intent to award for 13 grantees and are currently in the planning process for our next round of IPF grants. So again, our round one IPF engagement process was a year-long process. It was quite robust because this was a new funding area for the commission. So we started in early 2024 with some internal analysis of the BHSA statute. That moved into really trying to understand the county innovation projects, and we did some analysis of those projects, trying to focus in on projects that had been able to be replicated and lessons learned from those to see what should and could be included in our IPF framework. In April of last year, we did an open call for concepts and tried to widely distribute this open call and get ideas for what people were thinking about from various sectors around what could be transformational for the behavioral health system. Through the summer and early fall last year, we conducted listening sessions. I think we did 3 separate listening sessions that were then bookended by our PAC and CFC committee meetings, where we also got feedback in July and September. Throughout this process, starting in early 2025, we were meeting with state agency partners, including HCI, CDPH, agency, DHCS, and others to really try to get their input and feedback and to align efforts and make sure that we weren't duplicating. In November of 2025, the framework was adopted, and then again, our outline for the RFA was approved in January of this past year. Once the framework was adopted, we released the RFA. It closed in May. We now are in the intent to award. We just made the announcement on Monday. So Oh, I keep reading this slide. I forgot to talk about the RFA release in March. Sorry about that. After the framework was adopted, we released the RFA, then closed it. Then May and June, because we had such, it was great how many proposals that we received, but it took us some time to do our careful scoring process. So that lasted through May and June, and now here we are in July with just having made our intent to award announcement.
I have a question.
Oh, sure.
I'm sorry. Of the applicants that weren't in your top tier, what happens to those? What happens to them? I didn't see it in your deck. I saw the breakdown, but like of all of those applications received, where do they go? Can they reapply? Can they,
Oh,
do others look at it?
so they are, okay, so let me make sure I'm understanding the question, Commissioner Bear. So for the applicants that were not selected as the winning proposals, are they able to reapply to any subsequent commission procurement? And yes, the answer is yes, they would be open to apply for round 2 of IPF, to future Mental Health Wellness Act or BHSSA RFAs, as long as they met the criteria set forth in those procurement packages.
All right. And is that secondary? Are they public? Is it public information? Because like if there are individuals or companies that would want to fund those pockets outside the state funding, is there a list that is public?
There is not a list that is public. So we don't release kind of the projects that were not funded in case there are other entities or funders that would like to support them. Yeah, that has not been a standard part of our procurement process to make that list available. I don't know if Brenda or Sandra wants to weigh in on this question.
That is not, a question has not come up before, so that is something we can, what I'm hearing, Commissioner Bear, is you're thinking that there could be some use in something like that, that I'm not sure if that is something we could even do, but we can definitely take it back and think about it, see what we could do.
Right, but there might be community companies in those different markets, whether it's rural or cities, that might be interested in them.
Yep.
Wow, 307 applications mentioned this, Brenda, but that's Marissa, it's striking. The number we're able to fund is, as Pam mentions.
There's definitely a lot of demand.
All right, sorry.
No, thank you for the question. I mentioned that we've been doing some thematic analysis and some analysis of our applications just to try to understand the makeup of who submitted proposals, to help inform our engagement and planning strategy for round 2. So as you may remember, we had 2 categories for funding. Large grants for awards greater than $500,000, and then we had a bucket for small grants that were projects that were under $500,000. So the majority of applications were targeting the large grant category, so 62% versus 38% applying to the small grants. The small grants were limited to CBOs, tribal entities, so there were some restrictions on who was eligible to apply to the small grant category, whereas for the large grants, it was open to any public-private entity, public or private entity. For type, we were curious how many applications we received from County Behavioral Health as the lead applicant. And really the majority of our applications came from community-based organizations. Here we've just grouped the category more broadly as non-county behavioral health. So 93% were from CBOs, primarily CBOs. And then in terms of region, we had a handful of projects that really were focused on a statewide approach, but and then several that were regional. And then we also had a fair number that were county specific with with plans to be able to disseminate best practices and or replicate across other counties or regions. So you can see the kind of distribution of applicants by region. Because we had 307 applications, we felt like we had this opportunity to really look at whether there was some common needs identified by applicants, whether there were any trends to lift up around different populations of focus or models of interventions that would be worth kind of exploring further. So this is kind of just a preliminary analysis where we were able to identify, and this isn't the exhaustive list, this is kind of categories that rose to the surface. So we had quite a few proposals that were related to substance use disorders, prevention and early intervention, and outpatient type services. We had projects that really ranged from relating to care integration that tried to incorporate peers into the service delivery model or the training opportunity, non-clinical services. So again, that's kind of connected to the prevention, early intervention type projects. Lots of projects that were focused on, at some level, on coordination of care, and many that were kind of focused on developing an approach. So sort of a pre-pilot kind of proposal. The population of focus really did vary. I mean, we had proposals across the lifespan, many that focused on justice-involved population, a range of race ethnicities, as well as some that were targeted towards specific race ethnicity groups, languages, exposure to having a trauma history, and many proposals that focused on individuals who are unhoused or at risk of homelessness. Settings also really varied with many applications really focusing on providing services in the community and not at a clinic or not essentially at a clinic, but rather out in the field or within a community. And then challenges were ranged from identifying various behavioral health disparities, gaps in the system, ways that our service continuum is not yet culturally competent, and strategies to improve that, continuity of care, fragmented care, transportation stigma, distrust of the system. So again, we're still kind of trying to analyze these and better understand the needs from looking at these applications. And this analysis, again, is going to be folded into our other information gathering strategies, like our site visits and key informant interviews, to just plan for our next round of procurements. Okay, so for round one, what's going to happen the next 12 months? So we are, again, in the intent to award period, where we soon will be working to execute our contracts with our 13 winning applicants. We're targeting the beginning of October for that contract execution, so that then all the projects will launch. December, we should be starting to receive data, and by data, I really mean information and reporting from the grantees to learn about how early implementation is going. In March, we'll start to receive some quality improvement plans. So we really wanted to put into our grant monitoring strategy the ability for grantees to continuously assess how their implementation and project rollout is going, and to be able to identify where they may need to pivot. So we have some structures in place for identifying that early and working with the grantees to pivot and get projects on track so that they can demonstrate success and impact. And then in September, we will be compiling all of the initial year one results into an annual report, and of course presenting it at PAC and commission meetings so that we can share out year one results of all these exciting projects that we'll be launching very shortly. All right, so I mentioned that this procurement plan is going to kind of be echoed throughout each of our presentations today, but we really want to make sure that our committee understands, again, when to expect outlines, when, what this process is going to look like over the next several months. So because we did such intensive community engagement for round one of IPF, we do not anticipate needing to adjust the IPF framework. So going into round two, we are using the same framework that was developed and approved, developed last year and approved by the full commission in January. So again, in August, this is our information gathering period, our analysis and kind of outline development period. In September, we will come to the PAC with an RFA outline. So while the framework is going to remain the same, we're trying to incorporate some lessons learned into our actual procurement processes. So the PAC will see that outline for IPF in September. Then in October, we'll bring that to the full commission for a vote. November, we are going to have an invitation to for an intent to apply. And this step in the process is really to better understand how many applications we can anticipate, and to have kind of an initial phase of proposal or idea review. So we'll go into more detail in September about what that's going to look like, but the idea being that in November, the IPF will release an intent to apply process, and then in January, we will be releasing the invitation to submit a full proposal. And then that will again mean a procurement process that releasing an RFA in February for a May 2027 intent to award. So with that, I will now turn it back over to the chair and to committee members to ask any additional questions before we then move to public comment.
Thank you. Thank you for that wonderful presentation. At this time, I would like to invite any of our committee members to ask any additional questions or make comments on the presentation.
Well, I think
Hi, Commissioner Vernig.
yeah, no, I just my camera still isn't working. But yeah, first I hope, I know you will keep us in touch on the projects and how they're moving forward. But boy, guys, it just shows 307 applications were able to fund 13. So,
Yeah.
it shows the level of interest and others, but yeah, it would be good to keep us in touch on as the process moves forward.
Yeah. And I think it speaks to the bigger system as well. I mean, this didn't, it's more new to, and I think to just from the changes of everything that's going on. So I think we need to be informing also our partners and the state, that look what great need there is. And I think that's huge. It's not how much of a dent are we really making? And
Exactly.
that's the big concern. And I know it weighs heavy on all of us. And I think that when we share this with our fellow commissioners and we keep bringing this up, this has got to be a point that we really lift up. That, we're doing the best we can, but I think we also need to speak to our other state agencies. What are we all doing collectively? Because this is just a drop in the bucket. So thank you, Commissioner Burdick. You're absolutely right.
Now, I've been focused on employment and following up on this individual placement support. And even that, we talked to the providers in the field and the IPS Center of Excellence, and they'll tell you maybe 2 to 5% of those people who could benefit and are interested benefiting are probably being reached in California. So I think more of the counties need to do a lot more, but that's a separate discussion.
Yes, but very, very aligned, separate, but very aligned. And I think you're exactly right. Thank you. Other committee members?
I have a question.
Please.
Sorry. This is amazing work, so thank you. I'm just curious on sort of a contingency language and technical for people applying. Was it, did you find any holes in this round that it can open it up to even more? I mean, I know we had a lot, but I'm just curious as to the technical assistant in the rural areas because it leans more to the bigger cities, right?
I would say I don't have the percentages off the top of my head for our awardees, but we did make a number of awards that are focused on the rural regions. So 2 for Sutter Yuba, 2 for Humboldt Del Norte area, and then a regional plan for I think 15 or 16 of the superior counties in the north. And then, of course, a cluster of grantees from the greater LA area, 2 in the Bay Area, but not all were, big county, large counties or urban areas.
Right, but my question is, did you learn anything from those that couldn't bubble up to you? Was there, I mean, just in what, I'm just thinking to prevent people, the community centers in these rural and smaller that don't have the staff. It's more of technical applying because you know how it is when they apply for grants. It's really hard and they don't have the capacity. Did that come out in anything?
I think what the challenge for us for round 1 of IPF was that we had a lot of really strong proposals that we were not able to fund because of just the funding limitations. We had 20 million to allocate for 307 applications. I hear your question though, like were we able to find evidence that small grassroots organizations were, that there was either not representation in the applicant pool or that there were kind of technical issues that prevented those proposals from rising to the surface, not necessarily the idea itself, but technical issues. We didn't do a specific kind of analysis of that. I think just the volume was the primary issue we were trying to grapple with in our scoring processes. But yeah, it's something we can definitely keep an eye out for and think about ways that the commission might be able to provide some additional guidance or technical assistance to those prospective applicants.
Thank you, Melissa. Other questions or comments?
I have a comment. I'm sure that there will be some issues that arise and potentially some criticism, but I would like to congratulate the staff of the commission for getting this award out in such a speedy fashion. I think given the volume and the size of the commission, I think it's an impressive effort, and I'm sure that we can get feedback that we can absorb for the next round.
Thank you. Agreed. I think, it is a lot that you took in. And I think just being judicious with it and being fair and looking at need and, balancing need and also what we can replicate. I think that's important. When we have very little resources, what are we going to be able to look at? What's going to be something that will be able to replicate and meet the needs, especially when, again, I go back to the numbers and to what Commissioner Barrick said. We have to do the very best with what we have available, and how can we do that? So I think you all have done a wonderful job being really diligent and being thoughtful in the process. And so I applaud the efforts. And, as we sought for feedback from the community, and I think just doing that was so important and appreciate that. And we continue to do that. We want that to drive what is driving our efforts, and not just, sticking to everything that we're supposed to do, but really hearing from those that are receiving the services, living through the services. So I applaud the effort of the team, everybody that, listened to every call, read every comment, and helped shape this process. So thank you so much to Melissa and team. Appreciate that greatly. I'm going to, for the sake of time, move us forward. And at this time, I would ask that we please open it up. So we're going to go per item. So Marcus, if we could open it up to public comment, I will hand it to you, Marcus.
So I'll go over public comment procedures. For members of the public in the room, if you have not already, please use one of the green public comment cards located at the front to indicate you would like to make a comment on this item and any other agenda items. Cards can be given to staff located at the front table. When it's your turn to comment, I will call you to the podium or unmute your line and announce your name or the last 3 digits of your telephone number. We truly appreciate your understanding in this process. Chair, I am seeing no comments in the room, and virtually I do not see any comments either.
All right, then thank you. Seeing that we have no public comments and I see no hands raised from committee members, then we are going to go ahead and move on.
I'm sorry,
So,
some late
oh,
comments
okay.
online.
I stand corrected. Then Marcus, I'll follow your lead.
Okay, so we have 3 comments virtually. The first being Carla. You may go
Hello,
ahead.
can you hear me?
We can. Please go ahead.
Okay, so I'm Carla Kohler, and I was wondering if there is a possibility for regions that applied that weren't awarded in round 2 being in round 1 being prioritized in round 2.
So we can't respond, Carla, but if that's your comment, please.
I was just wondering if that is something that can be looked at. But that would be my comment, to have that prioritized.
Thank you, Carla.
Thank you.
Okay, next we have Candy. Let me go ahead.
Thank you. Yeah, so thank you for arranging the meeting, all Commissioner. So I'm wondering if people who are not awarded in the first round, will they be able to see their score so that like when they apply for the second round, they can have an improvement in those areas?
Thank you, Candy.
Okay, next we have Lisa.
Hello, my name's Lisa Kugler and I'm from Shatterproof. I'm also wondering if the commission may consider those applications that were not funded in round one, if we could see some aggregate of what were the primary areas, whether it was direct service, whether it was technology, some aggregate of those applications that were not funded.
Thank you, Lisa.
Okay, Donna, you may go ahead.
Hello, thank you so much. This has been so helpful. I'm Donna Jo Thorndale. I'm the grants developer with Jail Guitar Doors in Los Angeles. We were recently on a peer respite webinar and then learned that there were 7 counties that were not applicable, Los Angeles County being one of them, to the RFA that was released. My question is, for the RFA RFPs that will be released in February of 2027, do you know if Los Angeles County will be included in those opportunities that will be released? And I'll take my answer offline. Thank you.
Thank you.
Okay, next we have last name Tubera.
Hello, thank you so much. My name is Gayla Tubera. I am coming to you all from Humboldt Neural Health up in Humboldt County. I just wanted to take this moment to thank the commission. We were one of the small grantees, and this investment in our county and into our agency just means so much to the people here and to our clients. So thank you for this work, and I'm excited to see all of the other work that happens in IPF round 2. Thank you.
Thank you.
Next we have Debbie.
Hi, everybody. My name is Debbie Garcia Cesena. I am currently with NAMI of Imperial County in San Diego. So we look forward to having your visits come down here for your site visits. I do want to second the observation from Commissioner Bear and thank her for that observation, because as of prior with MHSA Innovations, all of those funds were pretty much supported and granted with the support of the Imperial County.
Debbie, you hit mute.
Oh, somebody muted me. I'm so sorry.
Sorry.
Okay, no, that's okay. So yeah, I would like that observation about having more TA and support to the nonprofits or community-based agencies that are now applying for these funds. It did open a lot of opportunities, but it also is a very competitive process now that smaller regional or rural areas are competing with larger or more regional facilitated services. So I would like that to be also something that the commission takes into consideration. The additional thing is, was there ever a consideration for each county to have a designated amount? And I understand it's only $20 million, but I just would want that because there are missed opportunities. That is all for now. Thank you.
Thank you, Debbie.
And last we have Lucianne.
Thank you so much for the meeting and for allowing me to speak. My name is Lucianne Latu, and I'm with Alama for Tongans in San Mateo County. I appreciate what Commissioner Bear shared about or asking about the TA and the support that may be needed for smaller organizations. I would ask that, I know that 307 proposals was a lot. I couldn't even fathom going through that in the scoring process. However, with the reallocation or the redirection of funds from preventative and early intervention from the behavioral health, this pot of money, it will be very, very competitive moving forward. However, I would ask if a landscape kind of a collection of that understanding, like those that didn't apply but would have if there was more support around applying for the funds. But also, I encourage the commission to rethink the stipulation where the organization must get a letter that shows support from the county health system when applying. I understand the reason behind it to have, where there's no gaps, but even in that pursuit of gaining that letter or what have you, it can be competitive, and it doesn't. And since the since the commission or I forget what office it was, but they're going to be doing interviews with key informant interviews with the directors of behavioral health in the state, that at the same time that they speak to these directors about if we're going to implement this eligibility requirement for the letter, that they build those relationships with the communities that they are held to serve, because it's like forcing us small CBOs to create a relationship that many do not already have established, and that is just setting us up for another barrier that we must have climb over or get through when we're already having challenges with applying. And I think that would be very, it would behoove all of us if we would understand what that looks like for all our different counties and regions. Thank you.
Thank you. All right. I want to thank everyone for their comments, and I'm glad we caught that. I think we moved just a little quickly on that one. So appreciate you. We do take into consideration all your comments. And at this time, we are going to go ahead and move on.
Actually, Mata, sorry, this is
What's
Brenda,
that?
and I'm so sorry. I needed to get unmuted. I couldn't unmute before to say for
It's
folks
okay.
that for folks who are wanting information on IPF, if they can please email those requests to our email inbox, our generic bhsoac at bhsoac.ca.gov email address. Yeah, please let us do that, and we can process those requests.
Thank you, Brenda. All right, so we are going to move on to agenda item 6. Good, I'm right. Okay. All right, for agenda item 6, we will be hearing an update on the Mental Health Wellness Act. Staff will provide an overview of the procurement planning and upcoming milestones. At the end of the presentation and discussion, we'll move to public comment. Because this is an informational item, though, there will be no vote. So at this time, I would like to invite Kaylee to please go ahead.
Thank you so much, Commissioner Madrigal-Weiss. Oh, I have a big echo. So my name is Kelly Clark, and I'm a acting assistant deputy here at the commission, and I have the pleasure today to take you through another large bucket of work that the commission has in our portfolio, specifically around the Mental Health Wellness Act and the various projects that we have funded through those funds, and including our plan moving forward with our next future rounds of Mental Health Wellness Act funding. So similar to IPF, the Mental Health Wellness Act funds are grounded in statute. So we have a scope for that. And what that really means is that what we fund is focused on ways to improve crisis services and the crisis continuum across the state of California. The funding for those projects is $20 million per year. And we have some ongoing projects that I will take us through, 6 total projects, 5 currently running, and then we also have some projects on the horizon, including our full service partnership projects, which in February of 2024, the Commission approved $20 million of Mental Health Wellness Act funds towards the improvement of FSPs in various areas. In April of this year, the PAC reaffirmed that is how we would like to use the funds towards FSPs, specifically with $10 million in performance management, and then another 10 million that we have yet to encumber that we will be presenting to all of you. But I want to start first with an overview of the amazing work that is currently running. So we have quite a number of projects, and you will see these are a range of areas, populations, all within the crisis continuum, but very, very specific and tailored and quite a wide portfolio. So we have current projects around empath, which are emergency psychiatric assessment, treatment, and healing centers. So these are connected to and embedded with hospitals. However, they are an alternative to emergency department use for individuals who are experiencing acute mental health symptoms. We see that often emergency departments have very long wait times with individuals waiting for those services, and it impacts not only the individuals who are in acute need of mental health services, but also everyone who's at the ED for other reasons. And so these, we have 9 grantees across the state. These are in various stages, and that is because each one of these empath units is custom to the needs and the situation of each hospital that it's working with. So some of them are construction, where they rebuild a part of the hospital to create an empath unit. Some of them are freestanding external structures, etc. So these projects are in various stages. However, we have some that have opened and had a soft launch, and some of them that are preparing to open now. These funds are expected to sunset in 2027, so in a year. We also have at the same time a project focused along substance use disorders, specifically a medications for addiction treatment project. We have 3 grantees in this area: Los Angeles County, Nevada County, and Marin County. And this is really a project that is in its second year and about building the infrastructure and the understanding necessary to expand MAT treatment across the state. This project is also expected to end in 2027. We have a relatively new project, our 0 to 5 maternal behavioral health project. It's a hub and spoke model, so that means that we have a core partner that we work with. We have 6 grantees across the state, and each of those core partners has a constellation of other partners that they work with to integrate services and provide really coordinated care for young people and their families. In this project, it is also fairly early, but it is expecting to wrap up in 2028. Moving beyond that, we have a peer respite project that is just getting started now. So this is a community-based, non-clinical short-term residential program. The RFA was recently released in just this month with anticipation of having 6 to 8 grantees across the state. County Behavioral Health Partnership is very important to this project. And we are in the first phase of this project, which is the planning phase, which is expected to wrap up in 2028. Phase 2 is a process improvement phase, and that is expected to launch immediately after phase 1. Then we have a project which is really happening in 2 parts. Our full service partnership funds are in multiple phases. The first one is $10 million for performance management. We are in the process of contract execution for that and the beginning stages of launching that project. That's to work with and partner between 8 and 15 counties across the state, and within those counties, 20 to 40 providers across the state. So it's a very large project. And the idea being to build the infrastructure and the TA necessary to support full service partnerships in performance management, which is related to being able to identify, set goals, data track, report, and improve processes from within the service provider themselves. The second phase of this project is yet to start, and it's a focus on integrating SUD and standard of care, including housing and peers. And we expect to release an RFP for this process soon. So the full service partnership project is in its launch phase for phase 1, and then moving into the start of an RFP process for phase 2. Looking ahead for our Mental Health Wellness Act funds, we have some areas that we just want to highlight as our focus areas here. Number one is around sustainability. These projects are incredibly valuable to the community, and we really want to ensure that grantees have the resources and the supports necessary to ensure long-term stability of these projects. And part of that is alignment with billing. So projects, we really want them to take advantage of new billing opportunities. And so TA and internal support from the Commission is an important component in helping grantees get to that benchmark. We do have a scope for populations, so Mental Health Wellness Act programs are focused on crisis services, but particularly for our BHSA priority populations, our individuals with the highest level of need where these services can really have the greatest impact. We also see an incredible use for data, not just in identifying future potential areas for services and need, but also we want our Mental Health Wellness Act programs to use quality data to drive their own improvements internally in service quality and client outcomes. And the Commission, again, is looking to how we can ensure that grantees have the correct supports in that area so that those data are used appropriately and help our grantees have the greatest outcome for clients. And then alignment. It's very important to us that our programs align with statewide efforts. We don't want to duplicate efforts. We want to identify gaps where we can really fill a need and have the greatest impact, or where we can work in tandem with our other state agency partners to multiply our impact. We also have a procurement plan for funding, which looks somewhat similar to what Melissa presented previously for IPF. However, we're on a little bit of a different time frame. So August is a big month for us all, but for Mental Health Wellness Act, we plan to be doing county engagement around future needs and opportunities and gaps in the crisis continuum, and learning from our county behavioral partners, including fielding a county behavioral health survey for behavioral health directors and their staff. In September, we will be developing the appropriate outlines that will take our learnings from past Mental Health Wellness Act grantees and from our county engagement to inform those RFAs. In October, those RFAs will have a robust internal, that's Commission staff, and external state agency partner and stakeholder engagement to receive feedback and make those RFAs more robust. And in November, we plan to bring the RFA outline to PAC. Then on the same timeline, we will bring the, assuming approval with PAC and recommendation to the Commission, we will bring those back to the Commission in January, and then hopefully have a release for those RFAs in February. And again, all of this is backward mapped so that we can reach a May intent to award. At this time, I'd like to open up and hand back to Commissioner Madrigal-Weiss for questions from our committee members and the public. Thank you so much.
Thank you, Kelly. Very much appreciate that. At this time, as Kelly said, please, any committee member comments, questions? It was an excellent presentation and very much appreciated. So it was very thorough, clearly. So with that, I'm going to ask, I don't see any, Brenda, anybody on screen? I'm not missing any committee member comments or questions?
I'm not seeing any.
All right, then I'm going to ask Marcus if you would please go ahead with opening up for public comment.
It was a very thorough presentation. There are no comments in room or on, well, I stand corrected. There is one online commenter. It was still a very thorough presentation. Lucianne, you may go ahead.
Thank you so much. Sorry, Marcus, for raising my hand, but I just wanted to encourage the committee or those that are doing the landscape or the key informant interviews of the county's perspective as far as behavioral health needs or gaps, or that even with that information, although it will provide a fuller view than right now, but that it's not the only view, because there are many community organizations that are trying to implement programs that may not be in the purview or the perspective of the county because funding restrictions and they're not necessarily the only quote unquote funder, but there is movement in community that they may not have the purview for. And I just would encourage that is also put into consideration and providing and getting that information from the CBOs directly or other organizations that are not the county behavioral health system. Thank you.
Thank you so much.
Thank you. Marcus, are we good?
We are good. No more comments.
All right. So at this time, we are going to go ahead and move on to agenda item 7. We will be hearing an update on the Behavioral Health Student Services Act, or BHSSA. Staff will provide an overview of procurement planning and upcoming milestones. At the end of the presentation discussion, you will move to public comment. Because this is an informational item, there will be no vote. And at this time, I will be recusing myself from participating in today's discussion and any related decisions concerning the Behavioral Health Student Services Act, or BHSSA, grants pursuant to the Political Reform Act Government Code Section 87100. My employer, the San Diego County Office of Education, currently receives BHSSA grant funding and may apply for future BHSSA grants. Involvement in decisions regarding BHSSA grants could affect the San Diego County Office of Education's financial interest. To prevent any potential or actual conflict of interest, I am removing myself from this agenda item. I will not participate in any discussions, deliberations, or votes related to these grant funds. In my absence, Marjorie Swartz has been so kind as to agree to chair this item. So Designee Swartz, I hand it off to you as I log off. Thank you, everyone. Take care.
Thank you very much, Dr. Mandrill. For agenda item 7, we will be hearing an update on the Behavioral Health Student Services Act, or also known as BHSSA. Staff will provide an overview of procurement planning and upcoming milestones. At the end of the presentation and discussion, we will move to public comment. Because this is an informational item, there will be no vote. Welcome, Kai. Is he online? Okay. Kai, you can go ahead, please.
Kai, are you able to start the presentation?
Looks like she's trying to unmute, maybe?
Okay, we're working on it.
Kai, I just sent you an ask to unmute. Did it work? Do you see it? There you go.
Thank you so much, Brenda.
I got you.
Thank you, thank you. And thank you, Commissioner Swartz, for the introduction. Good morning, commissioners and members of the public. It's great to be here today, now that I'm unmuted. I'd like to share 2 things with you today. A brief update on the Behavioral Health Student Services Act grant program, otherwise known as the BHSSA, and provide an overview of an engagement and procurement plan for the next round of available BHSSA funding. But before we dive into the details, I want to ground us in the real purpose behind this work. So I'd like to share a quote from a young person in Southern California whose life was directly touched by BHSSA funded services. And I quote, "I'm a junior in high school. My family and I have been homeless on and off for a few years, and it's been really hard on me. I've been in a gang since junior high, which has gotten me into some trouble with the police. I've been feeling down on myself, scared, alone, and depressed. Recently, my school opened a wellness center, and a friend suggested I check it out. I was skeptical, but I knew I needed help. When I walked in, I was greeted by another student, what they call a peer mentor, and that made me feel more comfortable and relaxed. Since then, I've been meeting with a peer mentor every day to catch up on my homework and improve my grades. I see a counselor every week, and even my mom has come in for counseling. This is the first time I've felt safe and connected to school. I'm now feeling hopeful about my future and working hard to graduate on time. I'm planning to go to college, which is something I never dreamed of before, all thanks to my school's wellness center. This is just one student, but stories like these are not rare. They reflect the very real and personal impact this grant program has had on student outcomes across the state. For us to better understand and strengthen that impact, the Commission is currently conducting a comprehensive evaluation of BHSSA in partnership with WestEd. CBH staff plan to present a preliminary evaluation findings to the Commission in November, and a final evaluation report is expected by mid-2027. So please be on the lookout for that. Next slide, please. Thank you. So to give an overview of BHSSA, let's start with the foundation. The Behavioral Health Student Services Act, BHSSA, is a statute in the Welfare Institutions Code and a grant program administered by the Commission. It's California's investment in building strong local partnerships between county behavioral health departments and their education partners, which include school districts, schools, and county offices of education. The goal here is to expand access to services on K through 12 school campuses and improve outcomes for young people who need support the most. In terms of funding, since its inception, BHSSA, the Commission has invested approximately $280 million in BHSSA funds across California to build and enhance these partnerships. And then beginning July 1st of next year, the next procurement will make $7.6 million available annually to continue advancing this work. And I just want to share some recent agenda items that have been on the Commission's calendar related to BHSSA. So last August in 2025, the Commission adopted the BHSSA evaluation plan, which provided a structured approach to understanding the grant program's effectiveness and guiding future improvements. And then most recently in January of this year, the Commission has approved 3 key items. First, a new SUD or substance use disorder integration pilot that's supported by $3.6 million and allows 12 existing BHSSA grantees to expand their substance use disorder programs and services. Another item is enhanced statewide technical assistance, which is an additional $1.5 million for the Center for Applied Research Solutions to support online suicide prevention training implementation under AB 2003 or 2003, which was signed into law this week by Governor Newsom. And then the last key area is a bold new procurement effort, which is up to $9 million for building school behavioral health performance management systems, giving counties and schools better tools to understand and strengthen their impact. And then lastly on this slide is just an update on the grant program status. So since 2020, the Commission has distributed 4 major rounds of grant awards to county behavioral health departments and their education partners. And each award has sort of built the momentum and expanded services across the state. The next slide highlights those awards and shows how the grant program has grown. So first, between 2020 and 2022, CBH funded 57 counties and 2 city municipalities, establishing and strengthening partnerships between county behavioral health departments and local education agencies. So this early investment really laid the groundwork for more coordinated school-based behavioral health services across California. Then in 2023, the Commission provided additional funding to 41 existing BHSSA grant partners, allowing counties to expand their capacity, broaden their activities, and deepen the behavioral health supports available to students. That followed in 2024 when the Commission launched BHSSA investments in 4 key strategic areas. First, grants to increase services for at-promise youth, including services for youth in the foster care system, youth in the juvenile justice system, and youth who are homeless. These are the Prop 1 priority populations. Another key area were grants to pilot test universal behavioral health screening to identify students as early as possible to prevent mental health challenges from becoming severe and disabling. We also provided grants to support long-term sustainability and fiscal planning, and grants to support other county identified priorities. So these target areas were selected to help counties address immediate needs while building long-term infrastructure for success. And then the last 2 bulleted points I mentioned earlier, just quick recap. In 2026, the Commission funded the expansion of substance use disorder services within 12 BHSSA county programs, and this was designed to strengthen the integration between mental health, substance use disorder supports, and school-based services. And then lastly, on July 1st of this year, we've launched the performance management contract in partnership with Santa Clara County Office of Education. And this really marked an important step toward building statewide systems for data tracking, continuous improvement, and better understanding of what works for students. Next slide, please. So this slide outlines the path forward for the next BHSSA procurement cycle. It's similar to the IPF and the Mental Health Wellness Act timelines. We're very excited about entering this phase, one that will be shaped directly by school, county, and community partners, and grounded in the Commission's commitment to meaningful engagement. As many of you know, and I think this bears repeating, collaboration is one of the Commission's guiding principles. We work intentionally to create inclusive spaces for input and to build strong partnerships that help shape innovative behavioral health policies and programs. So I'd say the next BHSSA procurement fully reflects that commitment. So this summer, the Commission's grant monitoring and research teams are engaging the community to gather key experiences and insights to help inform and strengthen the future direction of the BHSSA grant program. The Commission's recent strategic plan refresh sharpens our focus on 2 areas: Prop 1 priority populations, which I've mentioned, your system-involved youth, youth with emotional disabilities or serious mental illness, and also opportunities to integrate substance use services more fully into school-based and county behavioral health system. So our engagement events are underway. We're very busy. They include key informant interviews, focus groups, and surveys. And all of these efforts are, like I said, designed to inform the next BHSSA request for application. In September, we will take what we have learned and begin drafting an outline for the RFA. And the RFA document is intended to reflect the themes, needs, ideas that were directly raised through our community engagement. In October, we will also vet the outline internally and with key partners to ensure it is both responsive and strategic. And then by November, we plan to present the RFA outline to the Program Advisory Committee. This step will ensure the committee members and the public have an early opportunity to offer feedback and help to shape the final direction of the procurement. And then in January of 2027, the Commission will review the RFA outline for approval. And if approved, we plan to release the RFA in February of 2027. And then on the horizon for May 2027, we anticipate awarding the next round of BHSSA grants. So in looking at this timeline, I would say that it positions us to thoughtfully design, review, and release a strong RFA, one that invests in the next stage or phase of school-based behavioral health in California. So we're really excited about this procurement cycle. The energy and the ideas coming from our partners are already helping shape the work ahead, and we look forward to continued collaboration. So thank you. I will pause for questions.
Are there any questions among the commissioners or comments? Hearing none, I'm going to take the prerogative as the acting chair to make one. I have visited a number of the school wellness centers and have been extremely impressed. We have heard from students, similar to the story that was relayed here today, about the substantial positive impact on students that have made use of the wellness centers. I also have recently been in a public meeting where a representative of the County Behavioral Health Directors Association made a negative comment about school wellness centers. The comment was, oh, they shouldn't be opening school wellness centers when they're closing community wellness centers. So I think there's some disconnect, and I think that the representatives of the county behavioral health directors aren't as well educated about the role their members have been playing in opening and operating and making decisions about the school wellness centers. So hopefully, if any representatives of the association are listening here today, they will do a better job of educating their senior leadership that these are not done in a vacuum, and there's close collaboration with the county behavioral health directors. Thank you.
And there are no public comments in room or virtually. Just kidding. There is one public comment virtually. Candy, you may go ahead and speak.
Yes, thank you very much. I appreciate the comment and story. So I'm wondering for this procurement, would it be who would be the applicants? Like, are we expecting school district to apply for it, or the providers who partner with the school districts?
That's a great question, Candy. Thank you for that. The applicants, the eligibility criteria for the applicants are county behavioral health departments in partnership with local education agencies. But the funding must flow through the county behavioral health departments.
And Kai,
Did
to
that
be
answer
clear,
your question?
I was saying, Kai, this is Brenda. To be clear, this is per statute, correct?
Yes.
Can you verify that? Thank you.
Yes, it is. Candy, did that answer your question?
She gave you a thumbs up.
Okay, great. Thank you, Candy.
Okay, and looking, no more virtual comments.
No more, if there are no more comments, none among the commission and no more public, then I will turn it back to our chair.
I think that's actually, we're not going to call Mata back, so.
So we're at the end, I guess. Okay.
Yeah, do you have
Commissioner
agenda?
Schwartz,
Privilege
Chair Melody, I
to-
gave you the chair, so you can adjourn the meeting.
And there should be language for you, Commissioner Schwartz, to
so
do that.
thank you all for attending and for the comments today. And with that, we are adjourned.